Hi, my name is Tamara, and I'm going to be assessing my 19-year-old sister Amber. I'm going to be doing the cranial nerve assessment and the cardiovascular assessment. I want to apologize in advance because I completely left my stethoscope at work. This was actually done before and the video wouldn't upload, and I left my stethoscope at work, so I'll show you exactly where I would be using that and which side of the stethoscope I'll be using. So first I'm going to assess her olfactory nerve. And with this one, we use two different commonly well-known scents. So I'm going to ask Amber to please close your eyes. If you could just please tell me what this smells like.
It smells like mint.
Good. And then this is a very different but pleasant smell. So if you could just tell me what that smells like.
Coffee.
Good. So it looks like your olfactory nerve is working just fine because you can differentiate between smells. The next part of the assessment is to assess the second cranial nerve. For that one, we would test your vision. So the first portion would be to normally assess how far away you can read. For that, you would need a 20-foot space room, and you would stand 20 feet away from this chart and read the lowest line. For that, the person who's doing the exam would then write down what number it corresponds with that line. The best is 20/20. I don't have that much space in my room, but that is how you would do it. The other test that you would do is to use a Jaeger or Rosenbaum chart, and I don't have one of those, but I do have a book that is acceptable to use in this type of situation to make sure that their near vision works great. So for that part, Amber, I'd like you to cover one eye, and then read the top 3 words on this line.
Again the next day.
Good. And cover your other eye. And then read the bottom couple words on the other page.
If it was the needle.
Good. So by assessing that, we're able to see that Amber has normal vision when reading something like a newspaper or a book, which is exactly what the Jaeger or Rosenbaum chart would do. The next portion is to just kind of take a look at her eyes and shine a pen light into them and make sure that they are constricting and doing all of that well. So this is my pen light that I use at work. Just keep your eyes open and keep looking straight at me. So I'm just looking for a consensual response in both eyes and making sure that they both constrict in response to light, which they both did. The next part is to make sure that Amber's eyes are able to move in the 6 cardinal directions. And so I'm just going to have you keep both of your eyes open and just follow my pen for me. It's a little bit easier for you to follow. So we're going to go up and down. And all during this time, Amber is not to move her head. She's just to move her eyes. So Amber's eyes moved just fine in all of those directions. She didn't move her head at all. So they're working great. The next portion, just cover this eye for me. And I want you to tell me when you're able to see my fingers. And they should correspond with when I'm able to see them.
No.
Good.
No.
Good.
No.
And
No.
good. Now cover the other eye, and we're going to do the same thing.
No.
Good.
No.
Okay.
No.
And one more time.
No.
Good. The next portion is to check her facial sensation. So when you do that, there are 6 areas that you can touch. And you touch them first with a light object and then with a little bit of a sharper object. So for the light object, I have a Q-tip. And Amber, during this, I just want you to let me know if any portion feels different and if you don't feel it in one area to let me know. So I touch it up top and I do it on each side and go side to side. Those all felt the same?
Mm-hmm.
Okay, now I have a little bit of a sharper object. It shouldn't actually hurt you though, but it should feel a little bit sharper because your body has a different way of responding to sharp objects. Does it feel a little sharper?
Yeah.
Those feel all the same in all areas?
Yeah.
Good. The next portion is for me to check and make sure that your muscles of mastication, which means chewing, on the side of your face feel equal and that they aren't real big out or anything like that, and that they look symmetrical when looking at your face, which they do. Next, I'm going to ask you to do a couple silly faces for me just to make sure that everything is working just fine. First, I'd like you to arch your eyebrows and then keep them up. Close your eyes. Keep them closed. Good. So that tested her muscle strength in those areas. Next, I want you to smile. Frown. Good. Pucker out your lips like you're going to kiss someone and puff out your cheeks. Good. The next portion would be to do a hearing assessment on her, which would, the person would whisper something in one ear and then whisper something in the other and ask for either an appropriate answer to the question that you're offering or to repeat whatever you're saying or if they can hear you, that kind of thing. And if they can, then it's fair to say that their hearing is doing just fine. They don't need any further assessment. Next is to assess the glossopharyngeal and the vagus nerve, which include the uvula and the gag reflex. The gag reflex is like really not pleasant to do in someone that it doesn't look like it's indicated in. So she's been swallowing while I've been sitting here with her and she hasn't been coughing at all. So it's safe to say that that is working just fine. However, I will use this pen that I had cleaned off and ask Amber to stick out her tongue for me. And when she does this, I'm able to see that it doesn't deviate to either side, that there's a straight line down the middle, and that her uvula is midline, which also helps me assess cranial nerve 12. Next, I'm going to ask her to stick those out again and say ah for me. Good. And we see that the roof of her mouth, the soft palate, elevates symmetrically, which is good. Next, I'm going to ask Amber to crunch her shoulders up and keep them crunched. Good. Turn your head to one way and then come towards me. Good. And the other way. Good. So that assessed her spinal accessory nerves and seeing that they have proper strength and that they're able to move against resistance. That concludes the cranial nerve assessment, and next I'll move to the cardiovascular. Again, I'm very sorry I don't have my stethoscope, but I'll explain it as best as I can. So the first portion of the cardiovascular assessment is to ask Amber about any family history or any problems that she may be experiencing, like shortness of breath, or if she feels heart palpitations or anything like that. So before, Amber did tell me that her family does have a history of cardiovascular disease, and it's just something to keep an eye on during this time. But she is currently not having any symptoms of shortness of breath, fatigue, heart palpitations, or anything like that. So next, I would ask Amber to first lay down, and I would take her blood pressure and see what it is. She would then sit up. 2 minutes later, I would then take her blood pressure. And then I would ask her to stand, and 2 minutes later, I would take her blood pressure again. This assesses for any orthostatic hypotension or hypertension that would be the result of fluid overload or anything like that in her system. Some medications can also cause orthostatic hypotension and can actually make you feel a little bit dizzy. So at this point, I would ask the patient to take their shirt off, and Amber's not comfortable with doing that on a video, so I would just, during that time, I would inspect the anterior chest wall and make sure that it's symmetrical, that there's no pulsations, there's no heaving or anything like that that may signal anything that would be abnormal. I know with Amber that there is nothing like that. I would also look for the point of maximal impulse, which should be right around here, the 4th or 5th intercostal space, right in the mid-clavicular line. That would kind of be right underneath her breast. I would palpate it and make sure that there's no thrill there. Next, I would have Amber, if we had a bed that could go at a 45-degree angle, like most doctor's office beds and all the hospital beds are able to have an angle, I would have her lean back into the bed and sit it at a 45-degree angle and palpate for her jugular vein, and I would then measure that in accordance to her breastbone and see how many centimeters it pulsated. If it was between 1 and 2, then it would be fair to say that she has no jugular vein distension, and that is normal pulsation for her. I would then palpate for my pulses, which the way that I do this is I feel for both of my radial and make sure that they're even in as far as amplitude goes and that they're even in their rhythm. Next, I would ask Amber to just extend both of her legs out. And I would palpate for her dorsalis pedis pulses, which are right on the bottom of her feet. They're actually kind of in between the big toe and the middle toe, up on kind of the arch of the foot. Sometimes they're different in different people. And I would do the same thing there. If those are present, then her posterior tibialis, which are by her ankles, her popliteal, and her femoral pulses, it's fair to say, are all there because it's reaching all the way down to the dorsalis pedis pulses. While I'm down here, it's important to check, especially in our elderly patients, for any dependent edema. Edema around the ankles or in the calves, and you'd be able to see this by tautness of skin, and your finger indentation would be there. It's mostly, dependent areas would be like the legs, the sacrum, and if they're in bed a lot, the back of their head. Amber does not have any of those, and her dorsalis pedis pulses are palpable. So Amber's pulses are all very good. Next, I would ask Amber to stay the way she is. I would grab my stethoscope, and using the big end or the diaphragm, I would listen to, if you could just turn that way a little bit, her aortic, her pulmonic, Erb's point, the tricuspid, and the mitral areas. I would listen to those each for about 30 seconds with the diaphragm, and I would then switch over to the bell, listening in all of those areas again, because sometimes the bell is able to better detect any murmurs or anything, abnormalities in the sounds of the heart. Next, Amber would lay down, and we would do that also with the diaphragm first, and then the bell. When we're done with that, Amber would then lay on her left lateral side, and I would listen to that mitral area again, just to make sure that it's filling correctly and that there's no extra beats, there's the timing is all good, and we just are hearing those S1, S2 sounds. I would also make sure while I'm doing that her pulse is not any different with her breathing. Like if she's breathing in, if it gets quicker, or if she's breathing out and it slows down, or vice versa, there may be some sort of problem that we need to make the physician aware of. The last assessment piece of the cardiovascular assessment is to listen to the carotid arteries for bruits. These are very important because a lot of people can get plaque in their carotid arteries, and that can be fatal if that's not resolved, because it's a very easy area for plaque to break off and go into the brain, cause a stroke, and you do need those carotids for optimal blood flow to the brain. So I would listen first right here, and then on the other side. Careful not to occlude any of the artery because the brain does need that blood flow. So right now it's looking like Amber's cardiovascular system is in optimal function, which we would expect for a 19-year-old female. And after this, I would then document both the neurological and the cardiovascular assessment in the form of a SOAP format that would be best for any handoff reports or for the physician to see any specific problems that he may need to address. And that is all.